A very common question people ask me is that, sir, whatever vomiting, emitting and all we'll handle, sir. What happens to the long term? So we can actually divide this particular topic, what are the long-term effects of chemotherapy, into few parts. We can have effects on the heart. There are drugs like anthracyclines, it becomes like a rasna colored for breast cancer, which we give, and it's called adriamycin or epirubicin, which we give. That kind of drug has a small percentage, around 3 to 5% chance, it can cause something called cardiomyopathy. That is, it affects the muscles of the heart, where the heart becomes flabby and the patient goes into a congestive cardiac failure. These are not very common, but occurs around 3 to 5% of our patients, and we've seen many of our patients who have suffered with it, and we've been able to help them come out of it. Then afterwards, what is about the heart? Then afterwards, you have toxicity to the lung, like certain drugs like bleomycin and other drugs which we use for different cancers, like sometimes head and neck cancer, sometimes like lymphomas, like Hodgkin's lymphomas. When we use them, they can cause fibrosis. The fibrosis means the lung, which has to be like a nice honey cake, will become like one rusk. So therefore the breathing, there is the oxygenation, everything gets impaired. Then some patients, you will see that after taking chemotherapy, they are prone to develop second cancers by virtue of taking these chemotherapies to cure one cancer. After some time, there is a small percentage, 1 to 2% chance, they can develop a second cancer due to this. Like again, drugs like anthracyclines, when used for various different cancers, there is a 1 to 2% chance of getting a condition called acute myeloid leukemia or a blood cancer. Now, this doesn't mean that you stop taking your chemotherapy. All side effects would be there, but if given in a proper proportion with in a graded manner, you can prevent these complications to a large extent. Another problem which the patients come with is peripheral neuropathy. Sir, nara problem, sir. Nerves problem, sir. What does that mean? They'll have this tingling and pins and needle sensation in their feet and their legs. So that can also occur like in a set of drugs called vinca alkaloids or taxanes. While taking these medicines, you can have these kind of pins and needle sensation, slightly numbness of your feet and hands. Sometimes some people will get some amount of imbalance. So it's very important for you to talk to your doctor about all the symptoms which start occurring during your chemotherapy, so that the doctor can modify the therapy and sometimes stop the therapy if any of these symptoms are excessive.